Hello, Urška, Marin, and Garik. We have heard a little bit about your endeavors in healthcare and how you managed to put out a really nice and successful product. Urška, I would just like you to maybe quickly introduce yourself and what have you been doing and how, what was the success story behind that?
Mm-hmm. Hi, my name is Urška, and I'm the co-founder and CPO of Bellabeat. Bellabeat is a company developing health and wellness tools that help women track and manage their lifestyle and health. We started in 2014. In 2015, we launched our first product called the Leaf, which was the first wearable wellness tracker designed specifically for women in design and features. It was really successful on the market, and since then we have developed new wearable products and devices that help women track different things regarding their lifestyle and health. And now, newly, we've also focused a lot on developing personalization algorithms that take all of that tracking data in account when customizing their daily programs that help them achieve better health. So basically, we recommend workouts, meditation, supplementation, and nutrition based on women's lifestyle, biometric, and cycle data so that they can achieve their wellness goals in the healthiest and most efficient way.
Thank you. Marin, would you maybe introduce yourself and what have you been up to lately?
Hello, everybody. My name is Marin Maletić. I'm founder and CEO of company Neuroscience. Thanks for this invitation and the opportunity to speak here. Neuroscience is a company that is trying to put the neurofeedback method on the map of the world. This is one scientific method of balancing brainwaves that is known for 60 years already, and it's been hidden in offices around the world without actually getting the opportunity to become mainstream. And there are different obstacles to that. One of them is actually it doesn't have a viable business model. And we think that with digitalization and with AI, that time has come. So basically, what we are doing right now is we are transferring neurofeedback from offices to online. So far, it's a very interesting story. We started 6 years ago. I had personal experience with it, and I was very surprised that such a magnificent method is actually virtually unknown. Lots of doctors even don't know that it exists, and they still don't know. And it's very funny because you can actually get it in hospitals through the, I don't know, how do you call it in English? It's actually covered by medical insurance, but nobody knows about it, and we thought that something has to be done about it. And the very funny thing is that we planned to do this transfer to online. We started by opening the office center for neurofeedback, and it was very, very quick success because the demand was incredible. And then came Corona, and actually everything shut down, included our center, and we had like 50 of our customers actually left hanging without any access to the service in the middle of their training cycles. So we were pushed to do it sooner than we wanted. And it turned out that all these details that we were trying to polish before actually going to our main goal, and this is start working online, actually market didn't care about that. So they were already ready to accept it as it was. So now we are trying to polish our product and at the same time provide the service as best as we can. So basically that's it.
Cool. So we have a well-being example, we have the pretty clinical-oriented example, we have something fairly new coming to the market, something being there for a slightly more mature product still being developed. I would kind of like to focus maybe on this main topic. So Croatia is a testing playground for AI in healthcare. Let's first hear from Garik. Maybe you've done the whole process. What do you find are the main missing bits, not necessarily in Croatia, but maybe in UK? What are the main missing bits for this thing to be quicker?
It's a human factor. When we started talking to the surgeons especially, and they said, we can give you a prediction when the heart attack is happening. Most of them, especially experienced, they will say, I don't really need it, because I can see from my experience with my eyesight if this patient is going to deteriorate in the next couple of hours and so on. And they say, we're already using the prediction based on our personal experience without any AI and so on. And it's kind of what you can do better than I already know, what I call I cannot invent it here. But at the same time, they say, yes, but you're only one and unique for the whole hospital, but you have about 20 people, especially during the night, who are not there. And they say, oh, yeah, that actually will be useful. But this is the first barrier. I mentioned the nurses, but the nurses is the last barrier. Before you present your product to nurses, you have to convince like the management and the surgeons what they need it and so on. It's a human factor. It's probably, you cannot give a recommendation, this is what you need to do in order to overcome this human factor. You have to be a psychologist yourself a little bit to understand what's the goal of this person. Is he ambitious, he is driving, he wants to be the world leader, or he just has too much work and he wants to make his life easier and so on, and make your proposal accordingly.
Do you find this, have you had experience?
Yeah, maybe I can add on to this because so our experience from professional healthcare comes from before Bellabeat. Before Bellabeat, Sandra and I, my co-founder, tried to build a remote patient monitoring system for prenatal care together with my mother, who's still our chief medical officer, because she's an obstetrician gynecologist. And in that sense, it was also a human factor, but with the users, because with our experience with the care providers was that they really wanted to have a system that would allow them to monitor their patients remotely, because especially when it comes to situations like pregnancy, which if it's a normal pregnancy is just something that you maintain and monitor throughout the whole 9 months. So basically they were interested in how they could use technology to deburden the healthcare system and replace regular checkups with something that users could do, like patients could do at home. But the problem was that for them, it was the issue of reliability of that data. Because even if we created sets of devices that we would give to the users, if they were not connected directly to their system, they could not rely on the data that they were getting. But then, on the other hand, it was also the issue of the usage of those devices, if those devices were connected directly to the system and the data would seamlessly be integrated into their system, the problem was whether the users were using those devices properly or not. So this was also a really big part of the story why Bellabeat was then created and started to focus on the consumer first, or the patient first, and start to develop the devices that are comprehensive for the user, easy to use, and therefore create reliable sets of data. So even now when we don't focus just on pregnancy anymore and how women track a really wide set of data that is lifestyle, biometric, and cycle related, we still are in contact with professional healthcare providers, and they are very much interested in the data that we are collecting because they can become important part in predicting female health-related issues such as PCOS or endometriosis, better tracking of irregular cycles, and then all the other stages as well, pregnancy and menopause as well. So it always comes down to the technology adoption within the consumer, the reliability of that data, and then building the systems for professional healthcare providers on top of all of that. If that makes sense.
Yeah.
Yeah, it does. Well, our case lies somewhere in between the two cases. Neurofeedback is something that is applicable to even healthy people and to people with most severe mental illnesses. So it was basically, we had to make a decision where to go first. I think in our position, coming from a market such as ourselves before your project, we actually judged that it's much easier for us, and we'll do much more if we start from this, let's say, non-medical segment, like helping with different conditions like ADHD that are not really medical issues. They can be treated as such, but they don't necessarily need to be something treated like that. And in the future, actually, we are preparing to do that. We will work more on finding methods how to use neurofeedback with medical evidence, with enough medical evidence, which is really, really hard because you have lots of, it's impossible actually to create medical level evidence with neurofeedback because it is all subjective. So basically, what is a standard now for medication is you need to have randomized trials. So neither patients nor doctors can know what is applied, and it is virtually impossible to do like that. So basically, we have a very important problem how to solve it. And one way of doing this is actually to collect lots of data from the prophylactic use of neurofeedback, and then try to apply it in finding the right protocols for really, really sick people, if I may say so.
I want to give a particular example about our experience in Croatia. We have another product, what we call SAFE. It's basically a product, and this is not a marketing pitch, it's not a sales pitch. It's basically what it is to prevent the falling patients from beds. And this is a big problem, especially in the dementia wards where the people are old and they fall down, and that's a huge complication and a huge cost after this. We've gone through all the process about the ethics and clearance and so on, and eventually we used our experience in thermal imaging, because we do a lot of work for the security on thermal imaging, to monitor the patients in bed, and we use the machine vision and machine learning in order to predict when the patient is coming closer to the bed and raises alarm. It's, again, approved product. It's used in many countries and so on. We came to Croatia. We presented to a couple of hospitals. One hospital was extremely interested. We brought the system to demonstrate, and guess what? It was complete failure. One simple reason. Our system is based on the thermal imaging camera on the ceiling, monitoring the bed. All the examples what we used in the UK and everything were in the modern hospitals with, let's say, 3 meters ceiling high. While the hospital in Croatia, what we came, was a really old building with the 5-6 meters height of the building. And when you have a camera on that, the angle of view is much bigger. It takes a lot of more information. There is more noise, and was creating too many false alarms. So we had, and that shows actually what things like this are. There is no minor things. Everything is important. So we had to apologize, eat our humble pie, go back, modify the solution, and come back. And I'm pleased to say that hopefully from January we are starting the clinical trials, the first clinical trials in Croatia. I'm not allowed yet to say which hospital it is, but it's not in Zagreb, and we hope very soon to be able to announce it here.
That sounds really promising. I like this. This links to what Erin was pointing out about AI just emphasizing the biases that we actually have in whatever we were training on. With that respect, Urška, would you comment on your product being women-oriented and how that's affected it?
So when we started in 2014 developing consumer-oriented, so mass-produced and mass-targeting products for women, it was super hard because that category basically did not exist yet. Femtech did not exist back then. So we were the first in many things, the first ones that developed a wearable designed specifically for women. We were the first ones that added reproductive health tracking, so period and pregnancy tracking to the same system as your usual fitness stats or sleep stats tracking system. Then we also focused on things like mindfulness and hydration tracking because we saw that women are more interested in those topics than men are. But then when we try to develop that next step, so like what to do with all of that data, how we can actually use that data to help users achieve their wellness goals, women have a whole range of different wellness goals from trying to lose weight to get fit to even trying to get pregnant. or goals related to helping them transition throughout different stages of life. So either from puberty to adulthood, from adulthood to motherhood, and then to menopause. So women's health is hugely complicated and really hard to approach with a tool that would fit all. And what we were also lacking is scientific base, in the sense that women for years were excluded from research, from a lot of research that would help us develop that next step, because women's bodies made results of research unpredictable because of our cycle. So research would have to be much longer and differently managed to in order to include female subjects. But what we were getting from the data, from real data from our users, is that there's definitely something that is really important for female health, and that is correlations between our hormonal cycle and other data that we were collecting, that other systems were also collecting. So things are like lifestyle data, activity patterns, sleep patterns, and now also biometric data, things like cardiac coherence, HRV, temperature, and so forth. So we had this thesis, but we didn't have any scientific really proof for it yet, and also we didn't have enough funds to fund our own. So we could only draw correlation from our user data. But in the last couple of years, women's health really became kind of like the focal point of development in health and wellness especially. We've kind of expanded the meaning of femtech from being just focused on, at the beginning, on reproductive health tracking to a much wider category. And all of the scientific research that were coming up, and now we're also funding our own scientific research, have proven that there definitely are correlations, and this is something that we can use in this next step in helping users use their data to achieve their wellness goals. So we had to do a lot more digging and a lot more processing to be able to get somewhere with our product compared to our competitors that focused, that were developing kind of products for everybody, but basically they were designed for men because they were based on knowledge of male bodies and male health.
So it's bridging this gap in data, right?
Sorry?
That's bridging the gap in data.
Yes, definitely. Bridging the gap in data, but in not just data, in many things, also in how to create products for women, because we don't use products in the same way. We're not interested in the same way. We don't have the same health issues. So it's bridging a lot of gaps in different things.
Garik, I wanted to ask you, it really struck the message about nurses that they need to like they need to see the purpose in what they're introducing. How do you go about educating the nurses? Is it do you think it's more like education on the side about that one product, or do you just reckon that the nurses in general there should be like a whole track of education towards their digital maturity?
It's a good one. The third thing, before even you start educating, you need to show what your approach is not patronizing.
Yeah.
You don't come to them saying, "You're nurses, we have this great technology company, we want to teach you how to use our technology." It should be opposite. They say, "You are fantastic, and which is really the true life story. You're doing fantastic job, a very important job. We know you're overworked, stretched, underpaid, and so on. So what we're here is we have a technology which will help you to make your job better." And that's kind of, you bring the attention, and then you start building relations with them. So it's not like you drop your product there and they say, "Please call us if something is going wrong." We arrange, for example, with their permission, for one of our engineers to be constantly sitting there with them, talking and chatting and showing. And eventually, they're very busy. They have no spare time to drink coffees and so on. They will see, "Oh, what this guy is doing here. He's been here yesterday, he was here today," and so on. And they come in asking what to do. And he starts showing, and even surprisingly, after a few days, some of them, they wanted to stay after the work, because there is no time during the work to learn what it is and how to operate. And then we organized like a formal training courses and so on and so forth, because there was an interest. If you go to them, to the hospital, and say, "This is a training course for nurses," no one will come, because they're all very busy. And I would say, if I may say something, the building personal relations, especially in the healthcare, is extremely important. And it could go to two ways. If you remember in my presentation, I said what we started with the Charles, and then the two PhD students kind of been working. So the same applies to the students as well. So we've been working very closely with the student, and sometimes maybe too closely, because the co-author on my presentation, Stuart Henry, Stuart, he's now my son-in-law as well. So the personal relations actually sometimes goes too far away, but it helps.
Probably does, yeah. Urška, you mentioned you are also financing at this point your own research. So you kind of achieve this conversation with your consumers, and obviously with getting more experts into testing some of your hypotheses, and then getting that developed, and then kind of going and making the full circle. So what were where do you find that maybe the missing link is? Who needs to talk more with whom? Do you have, some of these were more challenging to achieve good conversation?
So yeah, the research that we're funding is still in very early stages, so it's still in organizational stage basically. So we're in the talking process. Where we find it to be the hardest part is finding subjects that are prepared to be participant in the research. We kind of focus on very specific data regarding the cycle and pregnancy. So it also sometimes goes into periods of women's life when they're more sensitive about their data. So data is definitely something where we find it to be like everything, with the reliability and then sensitivity of that data the hardest. So in that sense, we are kind of we get a lot of help from our chief medical officer, because she's kind of like the face towards the other professionals that would participate in the research. So that kind of makes it a lot more easier. It gives us credibility. It gives us kind of somebody that can talk to them. If we were doing it by ourselves without that kind of face, it would be a lot harder, because I think still technology is often perceived, especially in the professional healthcare community, as those kids that play with something and all these data and tools, and mentioning how can they know better than me from my own experience. But I don't know, I think there's more and more adoption. I think there's more and more care providers that really see potential in those kind of tools. So it's just building that credibility when creating the face that would actually interact with them.
Do you reckon getting a central access to, obviously you can't go and get all the women in Croatia or whatever other country with a certain level of problems. You can't just extract that from their electronic health records, but getting kind of a centralized access to ask more potential participants, would that probably be, or get the idea of the size of the pool?
But what we see, it's much easier if the care provider recruits their own patients, because there's a level of trust. Yeah. So it's not, us approaching them. It's somebody that has been with them through something, that is asking them to participate, and they kind of are better in also explaining the benefits or whatever. A great thing about the space we are in women's space, is that women's health space, is that the subjects, the users, women, are patients, very much interested in seeing innovation happen, in seeing new products being created for them. There's very much a presence of a need. So it's kind of easier from that aspect, but it's also a lot more sensitive compared to some other health topics or health areas.
Yeah. Thank you. Marin? It's kind of a similar question. So do you have any issues with reaching your consumer base, or do they just kind of flock in? You mentioned you were doing it online. You do most work.
Actually, we have sweet worry, unfortunately, because there is so much need for our service that we actually don't really have to advertise a lot. And since we have still some technical issues to solve, we are actually holding them a little bit off, because we couldn't really support the success if we would open the doors completely. There's been talk about, working with medical staff, with doctors and everything. My experience is that doctors, or this whole playing field, medical, healthcare, is actually very open to any kind of innovation. I mean, they are all driven by the will to help people. However, the medicine is a very, very, rigid system because it has to be. I mean, doctors, there are protocols for reasons. You cannot just expect from a doctor to be innovative. There is a ton of evidence that support which works the best, and they have to stick to that. So you cannot really expect them to be innovative. You have to come to them with hard data and explain them what is the protocol. And that is our job, actually. And the thing we are trying to do is actually to collect all the data from this more open market, like people that are trying to help themselves before coming to the doctor. And with that data, we hope, and with machine learning and AI, we will be able to provide, evidence with zero suspicion about how it works. And that's the only way you can actually enter the medical market. Pretty similar to your approach, actually.
Cool, thank you. So I think we're getting towards maybe the last last round of. I would like you maybe to think. I'm pretty sure the rest of Europe, especially UK, has something similar to what this edicts have been conceived to kind of offer to the entrepreneurship community and startups. Something similar. Do you see this actually being of some good kind of path to go, doing this ecosystem empowerment and trying to do this on a level of a...
I can say from our perspective, there are many reasons why we came to Croatia, but one of the reasons is, fortunately, it's a Brexit. What's happened, there were a lot of talk here about funding, how we can get funding to do the work and so on. In our case, we were successful because we managed to get like EU funding to do our development, and it was quite significant. And with this EU funding, we brought this product forward. After Brexit, it's a bit more challenging to get this funding. So one of the reasons what we're here is actually through the Rinicom in Zagreb, we are applying, and I would say quite successfully, to EU funding. And when you apply for funding, you need not only the good idea, but you need the partners, and you need maybe organizations like yours to work and to link and to network. So yeah, that will be a lot. I can see a lot of synergies between working together. So if there is a way for us to join you, we will be interested.
Okay. So one other thing I had to ask during your talks, UK, as far as I can tell, by not being EU anymore, I'm not sure if they do have to, if they do have to incorporate AI Act or not. That was something that I'm clearly not a legal expert on here, so don't take it against
the situation has improved now. So the British government committed to basically say UK companies can participate in the EU program, and if we are successful, then Innovate UK will provide the funding what was supposed to be. So this is now resolved, but there's still quite a few we cannot be the coordinator, for example. If you have a good idea and everything, you cannot drive this idea. You have to link it to someone and so on. But, yeah.
Urška.
To answer your question, yeah, there is a lot of synergies with what you do and the need with what you do.
Urška. So you have a product that is sold all over the world, right? And you still have development here, right?
Yeah.
Do you see this to be an advantage, or
yeah.
or is it something you regret?
No,
I'm
definitely. I think we've built an optimum infrastructure for growth. So when we started the company in 2014, we decided to go to the United States because we were not able to get any funding here. So we were accepted to Y Combinator, which is one of the most important accelerators in the world in terms of startups. So we were able to raise significant funds from private investors that enabled us to launch our first products and initiate our growth. But down the line, we have also, in the past, applied for European funding through the Croatian entity. because obviously if we have Croatian employees, we also have Croatian entities. So it's a really good infrastructure that helps us source funding from different sources whenever needed to supplement our own revenue. So from the funding that we get from our own sales. But in terms of development optimization, definitely having the core team here helps us immensely, because I think there's an incredible amount of really hungry talent here. There's still so much potential to grow, not just in Croatia, but in terms of region. We have many possibilities to also collaborate with also institutions in the region. So the things that we're doing in the medical sense, we mostly collaborate with institutions in Slovenia, because that's where I'm from, that's where our chief medical officer is from. But we can also do things with institutions here and so forth. So I think it makes it a lot easier for us as founders logistically, but also it opens up a lot of opportunities that haven't been drained up yet. And we would have a lot harder time just keeping our team in the States and trying to do everything in the States also, where things in terms of healthcare function a lot differently. Maybe it would be easier actually for us to develop and implement some systems, because of the private structure. They're very much more open to new kind of those kind of things, but complications might occur elsewhere. Yeah.
Does the GDPR and AI Act and these kind of special, maybe slightly stricter guidelines, that apply to Europe than complicate? They're two different.
Not as much as new legislations in terms of women's health being applied in the States.
Okay.
So I think that's a much bigger issue when it comes to data safety and user safety, that we're now remedying with things like private key encryption. So basically building whole sets of features just to protect our data and not allowing anyone to be able to access our data, because that's what we think is priority, the user safety, users' trust. So GDPR, in a sense, in Europe, forced a lot of companies to implement certain level of safety and trust for their users, and I think it was long due. So I think that was actually a positive thing, while things that are happening in the States are a real attack and threat to women's safety and privacy.
Okay, great. Marin, would you like to maybe give a couple of final words on how you see both your company's near future, and whether maybe this kind of building of a local AI community focusing on healthcare predominantly would benefit?
Well,
would
I think
from that or not?
this kind of gatherings and building an AI community in Croatia is definitely going to help us and many other companies such our company. But I think every region of the world has some advantages and some disadvantages. And it's up to us actually to look for opportunities and avoid obstacles wherever you live. So basically, this is a positive step. Negative thing about any kind of this, action is too much bureaucracy and too much involvement of politics into entrepreneurship. And that is something that I really resent here, because many times you have ideas that are here to help entrepreneurs. Personally, I don't really favor any kind of government intrusion. I'm not very keen on government helping anybody, especially entrepreneurs. But okay, this is a state of mind in EU, and it's widely accepted that politics has to give back money to entrepreneurs and to researchers. So that is something I have to accept. But when you see how the good ideas of helping entrepreneurs actually deform into some bureaucratic monsters that actually have hundreds of people turning over a couple of Excel sheets and treating entrepreneurs like somebody who wants to steal their money, I think everybody knows who am I referring to. This is something that I hope this idea will not transform into, because we have really, really, really bad experience with that. Maybe we are the only ones.
No, you're not. No, you're not.
Because our example is that we are not running for grants, not because we wouldn't like to get some free money, but because we really have too much things to do that we already put ourselves into that situation. But we applied for research grant, and the evaluator actually, who was not any kind of healthcare expert, actually said this is forbidden, very controversial, although there is, you can get it in hospital, covered with healthcare, and we could do actually nothing about it. And that specific, how do you call it, referee, evaluator, actually is also a person who gets that kind of money for different projects. So, I hope this won't turn into something like that.
I think this is one of the main issues, that every time we spoke to a startup, they kind of had one of the 5 main problems, right? So giving them a unique voice and mapping this. Croatia has done a really good job of mapping the AI landscape and doing the AI in healthcare landscape and giving them a unique voice and say, look, this is the main issues. Is probably what we can go to the policymakers with and say, this is the ones that we have to solve first for this to be doable in Croatia. And then, obviously, we're too small to be leading AI experts in Europe, but if we choose one niche of AI, and that is healthcare, we can be the European experts.
Well, I
right?
don't disagree with that. Why not? Why wouldn't we
And
be one of the leading voices in the EU? There are many examples of small countries that actually dominate the world in many aspects. So why wouldn't we be the ones to dominate in AI? You had lots of that kind of examples. So hopefully this will help us to be world leaders in AI. I don't see the reason why
Let's start with European leaders and then move on to the world.
Whatever.
But it is a unique market, and in a way it's a unified market in the sense that maybe Norway has some really good solutions, but Scandinavia is so far advanced. The rest of Europe is a lot more like Croatia, maybe slightly better. But then it is similar to Finland and Norway in their solutions. So building something that works in here means it's a lot more applicable to the rest of Europe than it is some solutions that are kind of on the very forefront. Okay, great. I think our time is pretty much running out. Shall we maybe give the audience...